Hello, I'm Robert Broe.
And I'm Kerrie Broe, and we've been a happily married couple and have worked together for over 38 years. We met at a natural healing school in Tampa, Florida, and we started our healing path together after graduating. We both had prior healing backgrounds. I studied Touch for Health system that involves manual muscle testing. I also studied diet, herbal medicine, macrobiotics, clinical nutrition, and traditional schooling in biology, chemistry, anatomy, and physiology.
I worked in the cardiopulmonary medicine field for 13 years, and then I let go of that trapeze of symptom chasing and went for the holistic one. So I enrolled in the natural healing school, and there I met my wife of 38 years now. After school, we worked in various clinical practices, and then we started our own clinical practice. I learned the most from the sick and dying people that came to us for help. Many were medical throwaways who were given a death sentence and sent home to die. They taught us what really works and what doesn't.
Schooling is an ongoing process, and we love learning. Fortunately, we followed our own path of acquiring knowledge and didn't have to unlearn traditional indoctrination. After we started our own practice, we learned that there were more pieces to the pie than what we had. So we began to study more disciplines and now have a knack for continuing education. Since there's two of us, we share course material together and absorb more information that way because two heads are definitely better than one.
We have a lot of common interests and we have a lot of overlapping. And in our healing walk, I think one of our biggest strengths is that we've studied so many different modalities together and have sought out and learned from so many fine people in their many different modalities of healing.
We've studied cranial sacral integration, biological dentistry, herbal medicine, nutrition, diets and blood type, structural alignment, mind-body medicine, meridian therapy, microscopy, frequency healing, and more. And as you work with people, you select different ways to help them. And it helps to have a lot of tools or modalities to be able to help patients.
Even though we've studied a lot of academic classes, some things I resonate with more, and some things Kerrie resonates with more. And so we each have expertise in different areas, but together we have a complete package that we offer to people.
Having a broad range of skills, we're able to use that palette of healing modalities to bring the best that we can find for every patient.
As part of our studies, we learned about frequency-related therapies, and we found out that this is woefully inadequate in the Western medical field. When we started to explore the world of frequency medicine, which we feel is the future of healing and medicine, we found very little information.
There's really nothing the medical profession has to offer in the use of frequency modalities. And we were very intrigued with this whole concept, so we started to use this technology more and more. Initially, we learned about frequencies that harm people and cause disease and symptoms, and how to avoid and mitigate them. Then we started learning more about frequencies that heal us.
So there are good frequencies that can be used for healing, and there are harmful frequencies to avoid that cause illness. So we're working with frequency-generating software that uses the healing frequencies. And we're using this with our sound table and applying them in our practice successfully. Some of my background is in music, sound, and light. I also have a background in electronics, and I was an audio consultant, and I sold hi-fi gear, and I've been a musician since my teen years. I was a laser artist for the Laserium company back in the 1970s, and so I was able to combine all these disciplines together from my past, and I created this table that heals with frequencies. When I learned about Dr. Reif's work with frequencies and studied the frequencies he used to heal people, I wondered, can we use these same frequencies with sound, with acoustic energy, instead of using pulsed electromagnetic signals? So we connected our sound table to a computer that had a software program that produces all of Reif's frequencies. And we started getting a lot of wins with our patients. we found that it does work very well, actually better than the electrically coupled method of applying frequencies to the body. I originally made our first sound table as an alternative way to listen to music because it couples the sound to your body through bone conduction, skin conduction, as well as neural conduction. It sounds like the music is coming from inside of you. So it's actually vibrating all the body's trillions of cells in an organized pattern to promote healing. Specific healing. We discovered that sound has the ability to manipulate matter more effectively than just an electrical signal passing through the body. An example would be if you've seen videos of people breaking a drinking glass or wine glass with their voice. The sound waves, the acoustic energy from their voice actually breaks the glass. It's pretty amazing to witness. If you put an electric signal through that same glass using the same frequency, it wouldn't break it. But the acoustic energy or sound waves actually moves the matter. So that's what's happening with the table. All the cells in your body synergistically move together and in sync with each other. There's a study called cymatics, which is the study of how sound affects matter. And as you can see here, there's a vibrating plate that's being controlled by a frequency generator. And as you sprinkle salt on the plate and then apply frequencies to the plate, making it vibrate, when it reaches a specific frequency of nature, all of the matter on the plate will coalesce into a symmetrical, geometric snowflake type of pattern. And then as you sweep to a higher frequency, it reaches the next standing wave and becomes a more complex pattern. But in between these standing waves, the particles go into a chaotic movement. And as you can see, with this flow of water being influenced by sound from a speaker, you can see the shape of the water stream change. This shows how the sound affects the water in our bodies.
Remember, we're mostly water, and when we lay on the table with a specific frequency turned on, the water in our body is affected in the same way, just like the particles on the cymatic plate. So it actually restructures the molecules in your body into a more beneficial pattern. Our table has been through many iterations, many stages of research and development, and we've been using it in our own clinic successfully for several years, and now feel that there's a need for this in the world and we want to release it. In our clinic, we use manual muscle testing from applied kinesiology. This gives us a way to communicate with the body and find out what the body is indicating for, or if something is compatible with the body or not.
As an example, if you muscle tested someone and initially their arm was very strong, then say you put their cell phone on them, or if they just got out of their car before they came to you and they've been blasted with Bluetooth, every muscle in their body will be weak. Then when you find the frequency that negates the weakness, it's like resetting tripped breakers in a breaker panel. All of a sudden it makes them strong. And you get the results almost immediately. It's incredible how quickly. These frequencies travel through the whole body. Sound travels through water 5 times faster than it does through air. And it travels through the fascia in the body. It travels through the bones. It travels through the connective tissue. It goes everywhere in the body.
And we have found through dark field microscopy that we can see an immediate change in the blood. You can treat people with frequencies for a few minutes and check the blood again, and you can see huge changes. We have documented this, and it's repeatable. It's a very profound, positive experience.
And we'll demonstrate this for you next with an actual patient and show you how quickly these changes happen.
I have really bad menstrual cramps. I've been having it since the age of 13, so the beginning of when I had my period. And it's always been very painful.
Okay. And are you mensing now?
Yes,
Do you have any pain now?
I have a lot of pain right now.
Okay. So what we're going to do is just have you fold your arm strong. And then I'm going to have you lie your hand over your uterus and fold strong. There's definitely an issue there. So what I'm going to do is put a frequency for menstrual disturbances and heal for 10 minutes. Here we touch again. Make sure this is the right frequency. Hold strong. Real strong. And body indicates for that. So we'll let this go for another 10 minutes and we'll retest. All right, we've gone 10 minutes and we're going to retest. So touch uterus. Hold strong. Push over your hip. And she's very strong. So how do you feel? Do you feel different?
I definitely feel a lot less pain. It's not so much pressure down there, not so heavy like before.
Good. Good.
I want to say another thing about frequency healing. It's new, but it's not new. Frequency healing has been used for thousands of years. People have used chanting, mantras, songs, and different instruments using sacred sounds to create healing. So in this forum, we have created a method that people can use in modern times. This technology can be used in any healing practice, from chiropractic, acupuncture, skincare estheticians, massage and Reiki practitioners, just to name a few of the fields that our frequency table integrates perfectly with their protocols. It's new, it's profound, and it's very, very powerful. It can also be used at home. People can use the many different frequencies to treat themselves in the comfort of their own home environment. The software that comes with the table is very easy to use. It produces over 2,200 preset frequencies. You simply select out of an alphabetic list of symptoms the ones that you want to apply to your present condition. But there is a sweep generator where you can sweep between two frequencies and cover the entire audible spectrum. And you don't have to be a trained healer. You don't have to be a computer expert. It's very simple, and anyone can do this. For example, you can select a common symptom such as heartburn or high blood pressure, anxiety, diabetes, insomnia, impotence, bone regeneration, and then select the duration, lie on the table, and let it take effect.
The average length of treatment time is 20 minutes, and you can get 3 treatments in an hour. You could use it 24 hours a day. You can't overdose on it. It won't harm you in any way. We like to use it at least 20 minutes to do a session, and we found that after 20 minutes, if we retest a previously weak muscle, it'll now test strong.
Another application for the table is with pets. A lot of pets get nervous with thunderstorms and fireworks or any loud noises, and you can select certain calming frequencies and just have them lay down near the table, and it calms them right down. Also, babies and young children respond very well to this technology. There's a recording in the womb of a mother's heartbeat, and it's a wonderfully soothing, calming frequency that you can use for babies and young children. This is what babies have been used to hearing for the last 9 months. So when they hear this, it's very calming to them. Some other frequencies that someone might want to use on a daily basis are immune enhancement, anti-parasites, anti-aging, anti-anxiety, and deep sleep, as so many people have a hard time sleeping. The 528 hertz frequency music is very relaxing and calming to people. It gets people out of the fight or flight sympathetic dominant state that they are stuck in and enables them to heal and have a lot more energy.
The software also comes with a binaural beat frequency section, chakra balancing, as well as other functions. In closing, the Tuberose Healing Sound Table is easy to use. It's affordable and a part of the healing future. And we're pleased with the results that people are experiencing, both in a clinical setting with their patients and clients and in home use. Thank you for watching.